Hello and welcome to another edition of BOULUNDALA News. News read by Lamin Doekwadi. First, the headlines. A fire destroys shops at the Kama market. Gambia has another case of coronavirus. Senegal recommends the cure medicine from Madagascar. This and other stories in the edition of radio and television from BOULUNDALA News. A fire outbreak had destroyed dozens of canteens at the Brikama market. A person suspected of starting the fire when he was burning the rubbish. Over $1 million worth of goods were said to have destroyed during the fire. Over $1 million worth of goods were said to have perished in the fire. The fire started at around 2 a.m. on Monday morning. The affected areas is next to Brikama Health Center. The fire couldn't be contained by the firefighters at the time, leading to a massive destruction. Most of the victims are second-hand sellers, shoes, bags, who managed with their little sales admit to a coronavirus lockdown. Some deportees and dark-weight returnees were among those affected. The Minister of Local Government, Musa Drame, accompanied by his permanent secretary, Buwasanya, visited the scene on Tuesday. He was received by Regional Governor Mr. Lamin Sani. The GDC leader, Mama Kande, also visited the market, as well as National Assembly members and other concerned Gambians. The victims were happy at the presence of the local authorities. The victims were happy by the presence of authorities on the ground. The Gambia has registered one more case on COVID-19. The new 23rd case is a 34-year-old male Gambian residing in Sierra. This was disclosed to the media by health officials in a press briefing. The laboratory confirmed case has been in quarantine on account of having a recent traveling history to Senegal. He was initially tested negative for corona at the beginning of his quarantine period, but was later found positive at the end of his quarantine. On May 11th, a few days ago, 2 more cases were also reported in the country. The Gambia currently has 12 active cases, 9 recoveries, 1 death, and 84 people under quarantine. The total number of people infected with the virus since the starting of the pandemic is 22. The 45 days public health emergency will soon end, but the rate of spread of the virus is alarming. The Gambia has received a consignment of 3 boxes of coronavirus or COVID-19 organic medicine from the President of the Republic of Madagascar, His Excellency Andrew Rajoelina. According to the dispatch from the State House, the consignment is part of a gift to ECOWAS countries towards the fight against COVID-19. They have been delivered to the Ministry of Health. It is not yet clear whether the country is going ahead in administering the drugs on the patients, but the recent statement from the Health Ministry indicates that the drugs will be best. In line with their commitment to ensure transparency and accountability, the Minister of Finance and Economic Affairs hereby published itemized expenditure list from the 500 million COVID-19 health emergency funds. 160 million has been released to the Minister of Health, which is the spending authority on all COVID-19 related matters. The Ministry of Finance will continue to publish further allocations and expenditure periodically, the ministry and the government, and by extension, reassures the public that it will continue to act in the best interest of the people of the Gambia. Bulk of money is budgeted for allocations, transport, vehicles, expenditures, hotel accommodations, training, among health and administrative expenses. The expenditure is meant for COVID-19 services and not for household emergency related for Gambians, as many people earlier expects. The ministry notes the need to reward frontline health workers in the fight against COVID-19, the purchase of vehicles and other relevant materials in coping with coronavirus. World Health Organization warns that if critical containment measures fail in the wake of coronavirus or corona pandemic, up to 190,000 people might be dead in Africa in the first year of the outbreak. The new research also predicts a prolonged outbreak over years. The WHO warning comes as Africa's most populated or populous nations, Nigeria and other African countries such as South Africa, Ivory Coast, Egypt, and Senegal began relaxing some of their lockdown. The estimates are based on predicts modeling and focused on 45 countries in the WHO Africa region, with combined population of 1 billion people. Egypt, Libya, Tunisia, Morocco, Eritrea, Sudan, South Africa, and Djibouti are not included. Across the African continent, more than 2,000 coronavirus deaths have been recorded by the African Center for Research Control. South Africa has the highest confirmed case of more than 8,200, while Algeria has the highest death toll of 483. Senegal approves Madagascar herbal medicine that is said to be cured coronavirus. According to Dauda Njai, the health Senegalese scientist community, they will work on protocol to see how to give it to Senegalese peasants. They have been evaluating the medicine. The country will soon start clinical trials of the herbal medicine and might be used as a preventive measure. Senegal currently has 1,492 confirmed COVID-19 cases. So far, 13 deaths. The COVID-19 medicine was first launched by Madagascar President Andrew Rajoelina last month. The drug has been developed by the Madagascar Institute of Applied Research. That ends this edition of Radio and Television Bulundala News.